NACCHO presents How to Fund Tobacco Cessation Initiatives for Survivors. Tobacco cessation services can help cancer patients stop smoking and improve survivorship rates. But how can state comprehensive cancer control coalitions build the capacity they need to support implementation of tobacco cessation programs at the local level? In this screencast, we'll give you a few tips for leveraging the resources you need to fund and carry out tobacco cessation initiatives at the local level. And we'll show you how to do it by examining a successful collaboration between the Michigan Cancer Consortium and Ingham County Health Department in Michigan to launch the Smoke-Free Ingham Breathe Healthy project. Tip number 1. Engage local health departments in high cancer incidence areas to expand reach of tobacco cessation efforts. As the agencies on the front lines of public health in communities, local health departments have the statutory authority to implement policies and programs that ensure cancer survivors have access to tobacco cessation services regardless of their socioeconomic status. Since states do not have direct contact with communities like local health departments do, engaging local health departments across the states in high cancer incidence areas can be a good starting point to implement efforts that have a wide community reach. In 2011, the Michigan Cancer Consortium and Michigan Department of Community Health initiated a collaboration with Ingham County Health Department in Michigan to launch a tobacco cessation demonstration project. The project was initiated in response to a high incidence of cancer patients in Ingham County who used tobacco products, a problem that was exacerbated because oncology offices in the area were not referring patients to cessation services. This partnership allowed for the expansion of the Michigan Tobacco Quit Line Protocol to add new screening questions for Ingham County callers to link them with counseling support, nicotine patches, gum, and lozenges, regardless of insurance coverage. Through this partnership, the Michigan Cancer Consortium worked with Ingham County Health Department to engage and train 19 local area oncology offices and Ingham County Health Department clinic staff to learn about evidence-based tobacco cessation intervention strategies, the effect of tobacco use on cancer treatment, and data management for patient referrals and follow-up. The participating provider offices and clinics identified tobacco use behaviors in all patient records and implemented the Facts to Quit component of the project to prompt a tobacco cessation intervention for all patients with cancer diagnoses. For any patient with cancer who reported using tobacco, the Facts to Quit form was completed and sent to the Michigan Tobacco Quit Line. Then, the Quit Line initiated first contact with the patient. This technique increased enrollment in the Quit Line and provided important counseling and support services to people who may not have had access otherwise, far ahead of the provisions of the Affordable Care Act that would offer similar benefits. Tip number 2. Help local health departments leverage funding and resources to support local tobacco cessation efforts. State cancer coalitions can support expansion of local health department-led cessation efforts by providing grants, technical assistance, guidance regarding evidence-based interventions, success stories, and connections to others who have been successful in local tobacco control efforts. For example, Smoke-Free Ingham County received startup funding from Blue Cross Blue Shield of Michigan. Additionally, the state of Michigan provided direct funding and training support to Ingham County Health Department and helped facilitate partnership linkages that led to the expansion of referral systems for cessation services. For example, as a member of the Regional Drug-Free Coalition, Ingham County Health Department and participating partners created a Quit Tobacco Resources listing that is updated yearly and distributed by area hospital systems, various medical partners in the project, the 14 clinics of the health department, and the Michigan Tobacco Quit Line. Patients now receive direct support for cessation, follow-up sessions, and are more likely to get through cancer treatment tobacco-free with the services. Through strong partnerships, enhanced screening and services for cancer patients became a standard part of the Michigan Tobacco Quit Line system, and the program has become sustained through funding from the state of Michigan, the Regional Drug-Free Coalition, and the Breast and Cervical Cancer Program. As a result, 1,800 residents were enrolled in the Michigan Tobacco Quit Line between 2012 and 2014, and all received cessation counseling and expanded support services. Tip number 3. Use NACCHO's local implementation site to learn strategies for building your coalition's capacity for cancer control. With support from the American Cancer Society, NACCHO's local implementation site is a valuable resource for building your cancer coalition's capacity to implement cancer control initiatives at the local level. It can help your coalition support local health departments in leading and organizing local-level cancer control coalition efforts, provide examples of successful local cancer control efforts and evidence-based practices, foster organizational leadership to support cancer control efforts within state and local health departments to fund and prioritize cancer control efforts, establish partnerships between local health departments and state cancer coalitions, leverage state funds across categorical chronic disease prevention programs to support local cancer control efforts, secure financial resources from grants, donations, and other resources, and organize your coalition for success. You can visit www.lhdcancer.org to access a clickable graphic for guidance and tools on various aspects of local implementation, including capacity, stakeholder engagement, data and measurement, strategic planning, visibility, leadership, and cross-coalition collaboration. Simply click the pie slice with your topic of interest, click the More button, and navigate specific solutions in your topic area. To learn more about how you can implement a specific solution, click the More button and you will be able to access a page with additional advice, tips, tools, and explorative questions to help you strategically plan your approach to cancer control. Here are a few takeaways you can use to build capacity to undertake tobacco cessation efforts targeting cancer survivors. Remember to implement the following tips. Number 1, engage local health departments in high cancer incidence areas to expand cessation efforts. Then, help local health departments leverage funding and resources to support local tobacco cessation efforts. Remember, you can help local health departments leverage funding from health plans, or you can encourage state health departments to fund local expansion of cessation initiatives targeting survivors by directly funding and/or providing technical assistance to local health departments. Tap into diverse chronic disease prevention funding streams, including cigarette tax funds, master settlement dollars, CVD prevention programs, and Medicaid, Medicare coverage to fund these efforts. The Affordable Care Act also offers provisions for expanded tobacco cessation services, such as requiring most insurance plans to cover preventive services that have received treatments. Research the health plans in your state to determine if coverage is available for tobacco screening, cessation counseling services, and cessation medications. And don't forget to use NACCHO's local implementation site to learn strategies for building your coalition's capacity for cancer control.